Hello there, I am Venus, and today we're going to talk about something that's been a hot topic among many women I've interacted with: vaginal tightening. It's a subject that transcends cultural and traditional boundaries, and I've spent quite some time gathering information that I believe can be truly beneficial. So if you are new to this channel, welcome! Please hit that subscribe button, give this video a like, and don't forget to turn on the notification bell so you don't miss out on any future content. And for those of you who are regulars, thank you for your continued support. Let's dive right in. I am going to share with you 4 effective ways to tighten the vagina. But before we get into the methods, let's talk a bit about why this is such a common concern. Many women, as they age or go through significant life events like childbirth or menopause, may notice changes in the way their vagina feels. It's a natural part of the aging process and hormonal changes, but it's something that can affect a woman's confidence and her intimate life. The first method I want to discuss is estrogen therapy. This is particularly relevant for women who are experiencing premenopause and menopause. Premenopause can start as early as 35 for some women, and it's crucial to be in tune with your body and recognize the signs of menopause, which can vary greatly from one woman to another. During premenopause or menopause, estrogen levels in the body drop. This hormone plays a significant role in sexual health. When estrogen levels decrease, the vaginal walls become thinner, less moist, and less supple. Estrogen therapy involves receiving estrogen shots that can help thicken the vaginal walls, restore moisture, and enhance sexual pleasure. It's essential to consult with a gynecologist to determine if premenopause is the cause of any concerns you might have. Now, let's talk about what happens during premenopause. The body starts to produce less estrogen, which can lead to a variety of symptoms. You might notice that your skin becomes drier, your hair starts to thin, and you may even experience hot flashes. These are all signs that your body is going through a significant hormonal change. And when it comes to vaginal health, the decrease in estrogen can make the vaginal tissues more fragile and less elastic. Estrogen therapy can help counteract these effects. By introducing estrogen into the body, either through shots or other methods like creams or vaginal rings, you can stimulate the growth of new, healthy tissue. This can lead to a thicker, more resilient vaginal wall that is better able to maintain its shape and function. It can also improve lubrication, making sexual activity more comfortable and pleasurable. But it's important to approach estrogen therapy with caution. It's not a one-size-fits-all solution, and it's crucial to work closely with a healthcare professional to determine the right course of treatment for you. There can be side effects, and it's not suitable for everyone. For example, women with a history of certain types of cancer or blood clots may not be good candidates for estrogen therapy. The second approach is laser vaginal rejuvenation, a non-surgical procedure that has gained a lot of attention in recent years. This procedure uses advanced laser technology to stimulate the growth of new collagen structures within the vaginal tissue. Collagen is a protein that provides strength and elasticity to our skin and other tissues, and by promoting its production, laser vaginal rejuvenation can help firm and plump up the vaginal wall. The procedure itself is relatively simple and can be performed in a medical office setting. It typically involves using a laser device to deliver controlled amounts of energy to the vaginal tissue. This energy stimulates the body's natural healing response, leading to the production of new collagen and the remodeling of the vaginal tissue. Over time, this can result in a tighter, more toned vaginal canal that is better able to respond to sexual stimulation. One of the great things about laser vaginal rejuvenation is that it's a non-invasive procedure. T here is no surgery, no incisions, and minimal downtime. Most women can return to their normal activities within a day or two, although it's important to follow your healthcare provider's instructions for post-treatment care to ensure the best result. The third method involves pelvic floor exercises. These exercises target the muscles of the bowel, uterus, and bladder, which are collectively known as the pelvic floor. The pelvic floor plays a crucial role in supporting the pelvic organs and maintaining urinary and bowel control. But it also has an important function when it comes to sexual health. Swimming is an excellent exercise that can help strengthen the pelvic floor muscles. The resistance of the water provides a gentle yet effective workout for these muscles, helping to improve their tone and function. When the pelvic floor muscles are strong, they can provide better support to the vaginal walls, leading to a tighter and more responsive vagina. Kegel exercises are another highly beneficial option. These exercises involve contracting and relaxing the pelvic floor muscles in a specific way to improve their strength and endurance. Many women find Kegel exercises to be a convenient and discreet way to work on their pelvic floor health. However, it's crucial to perform them with the correct posture and technique. I'll be creating a separate video to demonstrate the proper way to do Kegel exercises, so stay tuned for that. In addition to swimming and Kegel exercises, lower body exercises like squats and lunges can also be very effective. These exercises target the larger muscle groups of the legs and hips, which are connected to the pelvic floor muscle. By strengthening these muscles, you can improve the overall stability and function of your pelvis, which can have a positive impact on the vaginal wall. The fourth and final method is surgery, specifically vaginoplasty. This is a more invasive option that should be considered carefully. Vaginoplasty involves tightening the vaginal canal and supporting structures through surgical means. It can be an effective solution for women who have experienced significant vaginal laxity due to childbirth or other factors. However, there are several important considerations to keep in mind. First, vaginoplasty is a surgical procedure, which means it carries inherent risks. T here is a possibility of complications such as infection, bleeding, or adverse reactions to anesthesia. Additionally, the recovery period can be lengthy, and there may be restrictions on sexual activity for several weeks or even months after the surgery. Second, vaginoplasty is not suitable for all women. It's generally recommended for women who are not planning to have more children, as pregnancy and childbirth can reverse the effects of the surgery. Women who are prone to keloids, which are raised scars that can form after an injury or surgery, may also want to think twice about this option. Keloids can lead to scarring on the vaginal walls, which can make sex uncomfortable and may even cause pain. If you are considering vaginoplasty, it's crucial to do your research and choose a reputable surgeon with extensive experience in this procedure. Ask to see before and after photos, read reviews from previous patients, and don't be afraid to ask questions about the surgeon's qualifications and success rate. Remember, this is a significant decision that can have long-lasting effects on your sexual health and well-being. In addition to these methods, maintaining a healthy diet is crucial. Consuming foods rich in vitamin C, such as citrus fruits, pineapples, oranges, and mandarins, as well as fish, can support the production of collagen. This, in turn, can help strengthen and plump up the vaginal walls. Remember, the vaginal walls are composed of muscle, and they require the right nutrients to function optimally. For example, vitamin C is a powerful antioxidant that plays a key role in collagen synthesis. It helps to protect the body's cells from damage and supports the growth and repair of tissue. By including plenty of vitamin C-rich foods in your diet, you can provide your body with the building blocks it needs to maintain healthy vaginal tissues. Fish is another important food to include in your diet. It's a rich source of omega-3 fatty acids, which have been shown to have numerous health benefits. These healthy fats can help to reduce inflammation in the body, improve circulation, and support the health of your skin and other tissues. When it comes to vaginal health, good circulation is essential for delivering nutrients and oxygen to the tissues, which can help to keep them strong and resilient. It's also important to stay hydrated. Drinking plenty of water throughout the day can help to keep your vaginal tissues moist and supple. Dehydration can lead to dryness and irritation, which can make sexual activity uncomfortable and may even contribute to vaginal laxity over time. In conclusion, there are several ways to address vaginal tightening, from hormonal therapies to surgical procedures and lifestyle changes. It's important to remember that every woman's body is different, and what works for one person may not be the best option for another. If you are concerned about the tightness of your vagina, I encourage you to speak with a healthcare professional who can help you determine the most appropriate course of action for your individual needs. I hope this information has been helpful to you. As a fellow woman, I understand the importance of sexual health and the desire to enjoy a fulfilling, intimate life. It's a gift that should be cherished and nurtured. Thank you for joining me today, and I'll see you in the next video.